you look like
It's in the middle of the night. You hear a noise coming from your child's room. You go in to see what's going on. You find your child wheezing, gasping for breath, grabbing at her chest, and having uncontrollable cough. You become frantic. You take your child and rush him to the hospital. As they bring your child into the emergency room to help control the problem, you sit. The nurse comes over and asks you a couple of questions. Questions like, does your child have allergies? What is your family's history? And is your child on any respiratory medications or inhalers? At this point, you're too frantic to try to answer the questions or even think of an answer. After a while, the doctor comes in and tells you that your child will be all right. Then he explains to you that your child will need to be on asthma medications or respiratory inhalers for the rest of their life. The doctor also explains to you that this can go on throughout generations. That asthma can go on throughout generations. You see, asthma in my family is considered a generational curse. Why? Because my mother was born with asthma and bronchitis. My daughter has severe asthma. My granddaughter was hospitalized with severe asthma. And my grandson has asthma. Speaking from the point of view of a daughter, a mother, and a grandmother, I can honestly say that it is hard to see your family members suffer through an asthma attack. And that through knowing your family history, knowing the triggers, and how to take your asthma medications and what kind of medications can help you and the physician make you better. Therefore, I would like to persuade you all that there are actions that can be taken in dealing with asthma, and that asthma is a serious problem for all ages that can be controlled with three main factors. These main factors are knowing your triggers, knowing your family history, and knowing what kind of medicines and how to take your asthma medicines. After hearing the story in the introduction, You can see how asthma is a serious problem that does not care about age, and it often about age, and it affects thousands of people each day in the United States. In dealing with asthma, you must come to understand that it is a serious problem in the United States that affects all ages and countless amounts of people each day. According to the NIH Heart, Lung, and Blood Institute, asthma affects people of all ages, but it most often starts during childhood. In the United States, more than 25 million people are known to have asthma, and about 7 million of them are children. As you see, asthma does not discriminate of age, race, or where you live, or what you do in life. According to the AAFA, Asthma and Allergy Foundation of America, 44,000 people have attacks. 36,000 kids miss school. 27,000 adults miss work. 47,000 people visit the emergency room, and 1,200 people are admitted into the hospital. 9 people die each day in the United States of an asthma attack. These are very frantic numbers, I assure you. Therefore, allow me to share with you these 3 major causes of asthma in these people. There are 3 major causes of asthma in people, and they are the inflammation, also known as the swelling of the airways. Here is a picture of the airways. This is your lung, and these black lines are your airways. Now this is an airway that is clear, and air can go in and out properly. The second picture is the picture of the airway that is congested, that the muscles are constricted where very little air can come out. And here you can see the opening of the airway, nice and clear. And here, very little air can come out of it. Okay. Also, you would like to know there are triggers and your personal family history of asthma. According to the ADAM Med Encyclopedia, PubMed Health, NCBI, asthma is caused by inflammation, swelling of the airways. In a person who has sensitivity to airway asthma symptoms asthma symptoms can be triggered by breathing in substances called allergies or triggers. Most common triggers are listed by the ADAM Med Encyclopedia as dust mites, certain medicines like aspirin or other NSAIDs, change in the weather, most of cold weather, chemicals in foods and in the air, exercise, mold, pollen, respiratory infections such as common cold, strong emotions like stress, and tobacco smoke. There is a major need for knowing your family history with asthma. Many people with asthma have a history or family history of allergies such as hay fever, eczema, and others, and or others have eczema, or others have a history of allergies. As you have seen in the story, if you have seen in the story, in the beginning of the speech, I can trace asthma back generations after generations. It can be treated and maintained although there is no cure. The AAAI also gives a list of medications and inhalers that prescribed by allergists and physicians for the treatment of asthma in the threat and management section. According to AAAI, control meds are taken daily and include inhalers, steroids, frolicsome flavor disc, plus a long-acting beta agonist, or LAB. LABs are symptoms controllers that are helpful in opening the airway. However, in some people, they may carry some risk. LABs should never be prescribed as sole therapy for asthma. There's also the quick relief or reuse meds, also called reuse meds. Quick relief cannot be used more than twice a week. If more than twice a week, see your allergist. It is used quickly. It is used to quickly relax and open the airways and revive symptoms during the asthma flare-up, or taken before exercising if prescribed. It is important to know how these medications and inhalers work and how to take them as prescribed by your physician or your allergist. Now let's take a look and see how all the things tie together. After listening to the story at the beginning of what my daughter went through at an early age, and different family members are going through daily with this asthma, and how it affects thousands of people each day. I hope you can now see how serious of a problem asthma is, and that action must be taken in dealing with it. You can help by knowing your triggers and staying away from them, by knowing your family history, and by taking all your medications as prescribed by your physician or your allergist. In doing these things, the life you save may be your own or a family member's.